Okay, ma'am.
Okay, so we are discussing related to the subcenters. Okay, so like I have said, a subcenter covers 3,000 and 5,000 population. So what are the services mainly provided? So we have seen few of the services and facilities. Okay, so what are actually the main services which covers under the maternal and child health care? So like I said, first is your early registration. Okay, this is for the mothers, okay, who are pregnant mother. We used to register them whenever they come for health checkup. And a mother actually, it is necessary at least minimum 4 antenatal. Whenever we say antenatal, that means that is a checkup which is done during the pregnancy period. We call it as antenatal. Okay. So antenatal checkup means the checkup which is done for the pregnant woman. And whenever the word antenatal comes, that means it is for the during the pregnancy period. So the time interval during the pregnancy period, it is called as the antenatal. Okay. So urine testing. This urine testing is also done for pregnancy. Okay. So for in order to confirm, when the mother comes to the sub centers with a complaint of okay missed cycle or missed menstrual cycle, so they will give for a kit. Okay, we have the all those kit which is available, then all those kits she will use and she will perform this urine testing for confirmation of any pregnancy. Okay, then we will also give her counseling to the mother, especially to the expectant mothers. What are the foods she will eat, what are the how many health checkups she will need, okay, what are the immunization, okay, related to the baby care. Okay, so all those counselings we will give her related to family planning methods, what are the different form of contraception that she can use to prevent any unwanted pregnancy in the later time. Okay, referral. Whenever we say referral, it is like we are trying to transfer the patient. Suppose if a person comes in the community, if it comes to the subcenter with so many, suppose with a very severe complication, okay, which cannot be managed in a subcenter, so we are going to transfer that individual or the person to another center. Okay, suppose we will transfer it from the subcenter, we will take that persons to the suppose community health center, okay, which have more facilities or more this one services. So that is the meaning of the word referral. So whenever we say referral, it's like we are transferring an individual or a patient which comes to this center, we will transfer it to higher facilities, for higher facilities or for any treatment. Okay, so name based tracking. So this name based tracking is also, it is mostly related to the mother. Okay, so whenever a mother it is pregnant, so we will try to track down. Why we need to track down? To make sure that she have received all her antenatal checkup or the checkup which she required during pregnancy, and not only for her, even for her child. Okay, later when the child is born, whether the child have received all the immunization which is needed as per the national immunization schedule. So all those also we used to do in the name based tracking. Okay, so this is like we are trying to track the mother as well as the child, okay, in order to make sure that they have complete all the, okay, and you know if any other mother is also there with so many complications, so that also we will track in order to prevent, okay, any form of later complication. Health education means whenever we say health, so it is okay, and health means everyone, I think you know. Okay, education is like we are trying to, so health education, it means we are trying to give them a type of health teaching related to health aspects, like suppose it can be based to nutrition, okay, based to and lifestyle changes. So many health aspects we can give health education. Okay, so all this we are doing in the what when we can do this health education. Suppose when the mothers come to the hospital or any individual who needs care, when they come to the sub center, sorry, not hospital, so that time we will give them some form of health education or will give them some form of health teaching. Okay, that immunization is also very important services which is provided by the sub center. So immunization actually we are giving according to the national immunization schedule. Okay, so if you want to know about this national immunization schedule, you can even refer the internet. Okay, like we have immunization, I think even you all also, if you remember in your childhood, you must have gone, okay, to the hospital or to the center also for getting immunization. So different form of immunization is given both to the mother as well as to the this one young infant, or mostly to the children under 5 years. We have so many up to 16 years we are giving this immunization. Okay, then conducting delivery. So conducting delivery, where it is done, it is usually done in the type B type of subcenter. We don't do it in the type A. Okay, The newborn care corners, like in newborn care corners means at least we should have some specific equipments which is needed after a baby is born. Like we need a warmer, because babies, they are very prone to this one temperature, because as the this one their skin when they are born, okay, they are very prone to hypothermia. When we say hypothermia, that means where the temperature drops below the normal, okay, so they are very high risk for that, okay, because everything is still very not yet developed for the newborn baby. So that's why we need at least all those basic equipments needed for a newborn to be taken care of. All those should be there in a subcenter in a type B. Then postnatal home visit. Postnatal means this is a period after the delivery of the child. Okay, so antenatal means before the delivery of the child, and postnatal means post means after. So it is after the delivery of a child. So at least when we say home visit, is like where we a nurse or any one. It can be a health worker also, so they will go to the home of the individual of the mother, okay, after they are delivery, after they went home. So they will try to go home visit, okay, like they are trying to check on the mother, whether how is the condition of the mother, whether she is able to feed the baby, whether she have any other complications. So like that we used to go for home visit. Okay, 0 means on the first day itself, then 3, okay, on the third day, on the seventh day, and the 42nd days. Okay, so even after the mother the baby is born also, we try to go for at least 4 checkup, okay, in order to see the condition of the mother. So not only that, in order to also remind her about the other immunization that is needed for her child, okay, for her baby, so we will go for home visit, postnatal home visits. Then home visits, okay, like I have briefly mentioned. So home visit not only for the mother, just like that also we used to go for home visit just to at least see, okay, we'll go what are the we'll try to see what are the any type of problem, okay, which is faced by the people in the community. And if according to that, we will try to arrange some form of health camps, or we will try to help the people in order to deal with their problems, okay. And collecting and reporting of vital statistics. Okay, so whenever we say vital means it's very important. Statistics is like we are trying, whenever we say vital statistics, is we are trying to collect important information, okay. So important information is like your death, okay, if anyone is died in the particular community, we need to enter it in the register. Then if anyone birth, okay, even birth also is a vital statistics. Then if anyone get married, okay, all those also comes under your vital statistics, okay. Then school health services. So school health services, how it is done, like sometimes, not every time, okay, maybe once in a year or twice in a year. So the health workers from the subcenter, they might go to a particular school, and they might give them some form of, or they might do some screening, okay, they might do some dental checkup, they might give them some form of health education or health teaching. So those type of health services. Or they might also go and distribute this deworming, because for children, okay, during those days they will give those, or immunization if needed, they will go and give in the school. That is the meaning of school health services. Then disease surveillance, if any form of disease, if disease surveillance, whenever we say survey, we are trying to go to the community, okay, we are trying to get what, okay, we try to get the information of what is the main problem which is faced. Suppose like in the present scenario, we are having COVID, right? So we are having a pandemic of COVID. So during this time, everyone is aware, like we, and anywhere, everywhere, some patient might come up, okay, with COVID positive or anything. So what will do the healthcare worker, they will go to that particular community where they are assigned, okay. Then they will try and collect the information of the people in the community, okay, how many people have the symptoms, whether they are positive, whether they are negative. That is the meaning of the word disease surveillance, okay. So based on that, if many positive patient or many people are positive with COVID, so they will try to take up some action, okay, based on that. That is the meaning of the word disease surveillance, okay. Then control of locally endemic disease. Locally endemic disease means if any form of disease, it is endemic, means it is that type of disease which is not spread, okay, to other parts of the country or to other community. It is mostly seen only in that particular population. That is called as endemic, okay. So here also, if anything, suppose if during the visit of the health worker to the particular community, they have seen that many people are suffering from, many cases of malaria are seen. So based on that, that health worker, they will try to report it to the higher authorities, and they will try to deal and take up some action to control the malaria in that particular community. So that is the meaning of the word locally endemic diseases. National health programs. And not only that, okay, so we have, if you are aware, we have so many, actually we have so many national health programs which is being functioning under our countries, okay, like the National AIDS Control Program, the National Program for the Control of Blindness. So in these, all these health programs also, directly or indirectly, they are being uh, okay, they are being done from the subcenter. That means subcenter also, they participate in the implementation of all these health programs. Okay, and the last is the referral services. Okay, so these are the main services which are being provided in a subcenter. Okay, so I hope you are clear with this. Yes, any question till now?
No, ma'am.
Okay, so please be clear with this. Okay, so in the subcenter, we just remember, we have to remember how much population it covered. Okay, so what are the main categorization? We have type A and type B, and this is the staffing pattern and the facility. So these are the services provided in a subcenter. Okay, so actually in a subcenter, they don't have much room also. If you go, no, they mostly have only like one room for the doctor, then they have one room for the nurse, and they have some only mostly 2 room or 3 rooms like that. Okay, because they don't provide that much of other facilities except all this. Okay, so let's briefly see about the primary health center. Okay, so I have told you about that we have 3 forms of centers, okay, health centers in the community. So this primary health center, so this actually it covers more population as compared to the subcenter. So like this, the smallest one will be the lowest, it will be the subcenter. Then after the PSC, then the community health center. So the community health center will covers many population. So this it covers 30,000 population, and if you see in the hilly areas, it covers only 20,000. Okay, so this is the population covered, and in subcenter we have 5,000 in the plain areas and 3,000 in the hilly areas. So here although similarly here, okay, we are categorizing it into type A and type B. Okay, so type A primary healthcare centers, these are those where the delivery loads of less than 20 deliveries. That means in this type of primary health center, they have at least 20 deliveries. That means 20 babies are being delivered there. Okay, and if they have more than 20 deliveries, that is called as a type B. Okay, so this is the main difference between type A and type B primary health center. Okay, so this is a staffing pattern, so I will not go in detail with this. You can go through it later. So like I've said, essential means these are those which needs to be there, or it is compulsory. And desirable means it is not necessary, it might be there or not, but if it is possible, then they will should try to have this. Okay, so what are the infrastructure? Okay, so what are usually there in a primary health center? If you have visited anyone, usually they have some OPD, okay? Then they have some ward, at least 4 to 6 beds should be there in a primary health center. Then a labor room, usually for delivery of the child, okay? Then we have some logistic room, they will maintain all the statistics of all those, whatever, like I've said about disease surveillance and all those. Then a minor OT room. Okay, in this minor OT, they'll do some like if anyone needs some stitching. Okay, then if anyone needs some dressing to be done, so that can be done in this type of OT, operation theater. A storeroom where they will keep all the required, okay, equipments or drugs or anything. Then we have some infrastructure for the Ayush. Okay, so Ayush means this stands for all your Ayurveda. Okay, Unani, okay, all this homeopathy, all those comes under Ayush. Then cold chain room. Actually, when we say a cold chain room, okay, it is actually a room where we keep all the, we have all the equipments, all the, this one needed for the immunization. Actually, this immunization, whatever it is being given, certain temperature needs to be maintained while storing them. So we have so many equipments where we need to store them. So that is a cold chain room. I'll just in simple. Okay, a cold chain room where we keep all the immunization or the vaccines that needs to be given to the mother or to the infant. Okay, so all those vaccines, actually it needs to be stored at some certain temperature. So all those, it is maintained in the cold chain room. All the vaccines are being stored in the cold chain room. Then office room, okay, for the medical officer or even for other official staff. So we have office room, then a pharmacy, we have a laboratory, okay. They will do some simple laboratory testing like routine blood testing, and they will do some, this one, urine testing or all those. Residential accommodation is also provided in the primary health center. Okay, that residential accommodation for the staff, for the doctors. Okay, it is being provided. Then dirty utility room is where they keep all the dirty clothes. Okay, whatever it has been used. So all those would be there. So this is actually what is it in a primary health center. Actually, you'll be more clear if you have already visited a primary health center, then you will have observed all this. Okay. So anyhow, okay. So what are the main services provided in a primary health center? So here also the first services is a medical care. Okay, so what type of medical care it is being provided here? First is the OPD services. That means the outpatient department services. So at least 6 hours in a day should be there. So that means we have the doctor will be available for 6 hours, 6 days in a week. Okay, Sunday is usually closed. So this is the OPD services which is being provided. Then emergency services is actually 24/7. Okay, so where all the emergency care, if any emergency care needed to be taken care of, so that will be done in this. And we have referral services, like I've said, okay, referral in which we are transferring the patient. So similarly here also, if anyone comes to the primary health center, and if that patient or if the condition of the individual, it cannot be managed there, if they don't have all the necessary services, equipments or anything, then they will transfer this patient maybe to a district hospital. Okay, like that. They will try to transfer it to a different hospital. That is the meaning of the word referral services. Then inpatient services. So inpatient means whenever a patient, if it comes to the hospital, and if his situation is not getting better, okay, so they will try to keep the patient in the center. So that is the inpatient. Okay, so we have at least 6 beds, so the patient can be kept in that beds. Then adolescent health care. So in adolescent healthcare, so what are the main thing which is given is they have some clinics. Okay, so these clinics, it is usually functioning for 2 hours once in a week. Okay, not daily. We don't have daily. So at least 2 hours in a week, once in a week, they will have on a fixed day. So they usually have this adolescent health clinic. So this is mostly dedicated to all the adolescent boys, adolescent girls. Okay, where they give them if they needed any form of checkup, counseling, because in adolescent period, so many like bodily changes takes place and so many stress. Okay, because of all those, they are focusing on the adolescent health. Okay, and they will also try to give them some type of health teaching and all those. It's done in the adolescent health care. Then maternal and child health, including family planning. So this will be similar to the one which I have already mentioned in the sub center. Okay, so basic laboratory and diagnostic services. So what are the thing which is done here? They usually do some routine urine testing, suppose for pregnancy or for any for diabetes, all those. Then stool and blood tests, blood smear for malaria. Then all this blood for grouping. Okay, if you want to know your blood group, it can also be done here. Rapid test for pregnancy. So all these, so many X. Okay, so this just a basic routine test is done. Okay. So, and actually, then the next is management of RTI. RTI means this one, reproductive tract infections, and STDs means sexually transmitted disease. Okay, so all those also it can be done here. Okay, so they have some kits, various kits for various. Okay, for this with different color coding. They is actually used to distribute in the primary health center for the treatment of any form of sexually transmitted disease or reproductive tract infection. Their nutritional services, here they will try to distribute all those vitamin A, okay, for prevention of blindness. They will try to give some form of nutritional education. So all those comes on the nutritional services. Then collecting and reporting of vital statistics, it is same like how I've mentioned, where they will collect the birth rate, okay, what is the birth, the death, okay, if anyone is died, and that all needs to be entered in the register, okay, because those are very important statistics. Then school health services also, like here also they will do some screening of the children. They will go to the school, they will do some screening, or then they will give them some form of immunization if it's needed, like, okay. Then micronutrient management, they will give them some supplement if anyone is found to be deviated of any form of vitamins or anything, they will try to give it, okay, to the school children. And apart from these, they also do some form of health teaching to the children, not only to the children, as well as to their parents, to their teachers. Okay, whoever needs health teaching, they will, okay, the health workers, they will go and they will try to give the health teaching. So promotion of safe and basic sanitation. So this, what does it include here? Like they will do disinfecting of the water resources, okay? because as you know, water is also a main source where so many health problems can occur. Okay, so if you don't drink clean water, you might get so many waterborne disease like diarrhea, cholera. These are mostly related to water. So that's why water is also, drinking pure and adequate water is also very important to maintain our health. Okay, so that is why it is. And basic sanitation, when we say that sanitation means they should at least, okay, they should have a good toilet facilities. They should not do any open field defecation, because from open field defecation, it is seen that so many mode of, like, it forms as a mode of transmission of very form of various forms of disease. Okay, the national health programs also same here. So even in the PHCs, so many national health programs is also being initiated in from the PHCs. Okay, then various training programs. So this training program, it is usually done for the staff nurses, for the diets training. Okay, then and even for the ashas. Okay, asha, if you, I think if you must have heard of asha. Okay, so these training of asha also, it can be done in the primary health center. Okay, then selected surgical procedures also they used to do, like tubectomy. Okay, so tubectomy is usually a method of permanent sterilization of the female. Okay, if they don't want any more children later in their lives, so they can go for this permanent methods of contraception, which is called as a tubectomy. And vasectomy, it is for the male. Okay, then cataract surgery also, it is done in the primary health center. Medical termination of pregnancy, it means abortion. Okay, and whenever we say medical terminated, means this, it is legally, okay, it is allowed. If suppose if an individual, if a girl, it is, if she is a rape victim. Okay, or if the mother, if she have any complications, if, okay, which needs to, so in that cases they need to stop the pregnancy. So that type of situation, it is there in the medical termination of pregnancy. Okay, then record keeping, even here also in the primary health center, we keep so many records. Okay, like immunization record, then the mother's record, like registration record, antenatal checkup record, then growth and monitoring of the child record. So various form of records is being maintained in the primary health center. Then we also have health education and behavior change communication. Then referral services also same. So they, when they will refer the individual coming to the centers to the different center, okay, to the different center or to different hospital. And what also comes in referral services is the transportation facilities. Okay, so transportation facilities also should be provided along with the referral services, which will transfer the patient to that center. Okay, so this is about the primary health center. Okay, so are you clear with the primary health center? Yes?
Yes, ma'am.
No question. Have you seen a primary health center, or have you visited any? Yes, I think you must have visited. Maybe you might. Okay, so we have so many primary health centers. Okay, let me briefly tell you about the third one we have is the community health centers. Okay, so here also in the community health centers, actually here we have, anyone have any question or what? Oh, who's asking? Okay, staffing pattern. Staffing pattern for which one you want?
Primary health center.
Okay, primary health center, right? Okay. Okay, so actually these staffing patterns, these are the list of the people who should be there in a primary health center. Okay, so the medical officer, that MBBS. Okay, so this actually you might not need to memorize it, but just I'm giving you just for your knowledge. Okay, so like essential means we have to have, like I have said. So in the medical officers of MBBS, at least in a type A and type B. So here they have differentiated into type A and type B. Okay. So the first is a medical officer. Medical officer means your doctor. Okay, so doctor, MBBS doctor. One at least should be there in type A, and in type B also we need to have one. But the main thing is that if possible, if it's okay, if available, if the resources is there, or if they have, if possible, then we need one more in type B. Okay, because as you've seen that in type B they usually conduct many deliveries and as compared to type A. Okay, so desirable means it is not necessary that the staffing will be there, but it's permitted or if they are able to do it, okay, they can have one more. Okay, then Ayush. Okay, so Ayush doctor also usually used to be there in a primary health center. So actually Ayush till now, okay, we have not only in few centers it is there, but it is not usually there in all the centers. Okay, then account come data entry operators, so he will be the one doing all the data entry if anything like any disease surveillance or if anything which is there, so he will be the one doing the data entry. So this data entry operator also the accountant, so we need one. Okay, so essential means we need, it is compulsory that he should be there, so we need one in both type A and type B. A pharmacist also we need one in both type A and type B. So it's compulsory, at least one should be there. Then a pharmacist for Ayush also, this is actually also we need one. Okay, but this actually till date we don't have such, okay, pharmacist for Ayush and all, but mostly we have just the pharmacist. Then a nurse midwife, that means a staff nurse. Okay, so a staff nurse also we need three in the type A of PHC, primary health center. And if you see in the type B, we need four. But if it is possible, it is good at least if to have one more, okay, both in type A and type B. But this is desirable. That means if it is there, it's okay. But if it's not there, also it's fine. Okay. So it's desirable is something that the government is trying to achieve. It is not yet been achieved, but they are trying to achieve this much of manpower. Okay, but at least minimum three should be there in type A, the staff nurse, and minimum four should be there and in the type B. Okay, so the health workers female. Okay, so these health workers also they are different from staff nurse. Okay, so these also we need one. Okay, then the health assistants male, these also we need one each, and as well as the health assistant female or the lady health visitor, these also we need one. Then a health educator, this is desirable. Okay, so till date we don't have any health educator, okay, at present. So this is desirable, that means these are which something which the government are trying to achieve, they are trying to get. Okay, then the laboratory technician also we need one, both in type A and type B, because we don't need that much type of testing. We don't, only routine testing is being done. So that's why we need only one laboratory technician. Then cold chain and vaccine logistic assistance. Also we need one, okay, desirable for type A and type B. So this cold chain people, this will be the one who will be managing or whatever I have told you about cold chain, where it is a room where we keep all the vaccines. Okay, we have to maintain the temperature, we have to note down, okay, what vaccines have been stored in which type of equipments. Okay, so what is the temperature of the vaccines. So all this will be done by this cold chain and vaccine logistic assistant. Then the multi-skill group D worker also we need one, and the sanitary come workers come watchmen. Okay, so this sanitary worker, that means those who will be doing the cleaning and all those, and even watchman. So this also we need one in both type A and type B, and in type B actually we need additional one more. Okay, so this is, so in total we need for in type A we need 13, and for type B we need 14. Okay, but if you count total with desirable we need 18. Why it comes to 18? Because we are plussing everything. Okay, so we are plussing the essential plus desirable. That's why in desirable the number it comes more, so it becomes 18, because here it is 13. Okay, suppose in type A the total number of staff is 13, but if you plus it with the type B it comes to 18. Okay, so this is how it is, the staffing pattern in the primary health center. So desirable, don't be confused with desirable. Desirable means it is something which the government are trying to achieve. Okay, it might be there or it might not be there. But for essential means it is compulsory, at least these staff should be there in the primary health center or even in the other centers, okay, sub center or anything. So essential means it is compulsory that it should be there. Okay, so are you clear with this? Because are you clear? Hello?
Yes, ma'am.
Okay, so if you want to be more in detail on this, you can refer the internet also. Okay, because these, but at least these minimum people should be there. Whenever we say essential means it's compulsory, it should be there. Okay, desirable means these are something which our government, because this is actually standards which is given from this, but it's not necessary that whatever it is there in the standard it is possible to follow. Okay, but they have just given the initiative that if you are trying, if you are able to do it, you should have all this extra stuff. So this desirable is like an extra staff where it is like if you have it, it is well and good, but if you don't have it, so it's not an issue. So it's like, but for essential, all these staffs should be there. Okay, so it should be there in type A or type B. So there's 13 staff should be there in type A and 14 staff should be there in type B. Okay, clear? So similarly, the same goes for
Excuse me,
subcenter.
ma'am.
Yes,
Ma'am, why it is divided into type A and type B?
that is actually given by that IPSS, na Indian Public Health Standards. It is not given by, so they are the one who divide, because actually it is more easy if you divide it like that, so that based on that they'll be able to divide the resources. Okay, how many people is needed for type A, because type A, like we have seen, like I've told you, there are those which conducts a minimum at least 20 deliveries they are conducting in a month. But if you see in type B, they are conducting more delivery. That means they are conducting more than 20. So based on that, they will be able to divide, okay, in this type B, since they are conducting more deliveries, so in this type, we will give them more staff. That's why we have extra staff nurse, we have one more, right? Because we need extra staff for that. That is the main reason why we are dividing the primary health center in that way. So by dividing it in that way, it becomes more easy to divide all the resources. Okay, so that at least in all the centers they should have all the necessary resources. Resources means like manpower, your equipments, whatever it is needed, they'll be dividing it equally according to the type of services they are giving. Otherwise, if you give, suppose type A, even if they are delivering only 20 deliveries, but you're giving them same type of manpower, or you're giving them same type of resources, then that will be, okay, it will be like sometimes it might cause scarcity of resources also. So by dividing it into type A and type B, so based on the services that they are giving, okay, that they are providing, so we are provide to those who provide more services, we will give them more resources, okay, in the form of money, okay, manpower, in the form of equipments, like that. So that is the main reason why we are dividing it into type A and type B. Okay, clear? Yes.
Yes, ma'am. Thank
Yes,
you.
Okay,
ma'am.
so that is the main reason why we are dividing into type A and type B. Actually, in before we don't have this. Okay, so this was actually started in 2012. This Indian Public Health Standards, they have given this in 2012. Okay, before that we don't have this categorization of type A and type B. We only have a subcenter, PHC, like that, but we don't have like type A, type B, or like that. Okay, so that is actually the main reason why they are dividing it. So it will be more clear, and also it will be more uh, good. Okay, it is be more better to divide everything. So whoever provide less services will provide them all the resources according to the services or the facilities they are giving. So that is the main reason, but these are the only differentiation. Otherwise all the other services, it is almost same. Okay, all the other services, it is almost same in both type A and type B. So whatever services that I have mentioned, all this OPD, all this referral, okay, maternal, this is actually, it is same in both type A and type B primary health center, but just that the services for delivery is a bit different. Okay, so in the delivery, in type A, they have only 20 deliveries, but in type B, they are having more than 20 deliveries. So that's why, that is the main reason why we have extra one staff nurse. Okay, because the nurse, they will be the one who will mostly conduct all the deliveries and all. Okay, so for that, because in type A, type B, since they are having more this one deliveries, so they need extra staff. Okay, clear? Okay, so for the community health center, I will continue in the next class. Okay, so I hope everyone is clear with sub center. Okay, so a sub center, it covers 5,000 and 3,000. So actually why we have more less in the hilly areas, because those are areas, some of the areas might be very outskirt, okay, which might be in a very outskirt population. So for that, actually we cannot, the one like those help manpower might be less if we keep many population to cover. So that's why they are giving less population to cover in the outskirt area or hilly and difficult areas. Okay, so these are the type A. So type for subcenter, mostly it is divided according to whether they are conducting delivery or they are not conducting delivery. Okay, if they are conducting delivery, it is called as type A. If not, if they are not conducting, sorry, it is type A. And if they are conducting, it is called type B. Okay, so this is staffing pattern, treatment, okay, services. And in PHC also they cover 30,000 in plain areas and 20 in hilly areas and difficult areas. The same reason also goes here, okay, because it might be in a very outskirt area, so it might be difficult for the health workers to cover many populations. So that's why, to make sure that all the people are getting all the adequate services, so that is the main reason why they are trying to covering less population. And here also we have type A and type B, in which type A it is those which have a delivery load of less than 20, and type B means they have a delivery of more than 20. Okay. And these are the infrastructures. So just remember, in a PS, in a sub center, actually we don't have all this inpatient facilities and all. Okay, so this is started from the primary health center. So in a primary health center, we need at least minimum of 4 to 6 beds. Okay, so if a patient, they might stay for 1 day or few days. Okay, so these are the services being provided in a primary health center. Okay, so are you clear with both? So in the next class,
Yes, ma'am.
I will continue with the community health center. So community health center, actually it covers more population. So like this, it like the levels goes up, okay? From the sub center, it covers that much, then PHC will cover, then the sub community health center, it will cover more population. So this, it covers 80,000 to 1,20,000. So, and not only that, so based on that also you can imagine. So here they're providing more services. Many services will be there in the community health center, which is not given by the primary health center or the sub center. And this actually this community health center, now we also call it as a first referral unit. Why we call it as a first referral unit is that suppose if any individual come to a sub center, okay, and if that individual cannot be managed there, then where they will transfer it, first they will transfer it into the community health center. Okay, so that's why it is also called as the first referral unit. That means it is the first choice of transferring a patient or an individual from the sub center or the primary health center. Okay, so anyhow, so the details of this community health center I will take in the next class. Okay. Okay, I hope everyone is clear. I'll be sharing the slides, and if you still have any doubt, you please ask me in the next class.
Okay, ma'am.
Okay, fine.
Okay, ma'am. Okay,
Actually, the
ma'am.
photo which is given here, it is Dhirenpara. We have one health center, okay, community health center, maternal and child welfare hospital. Okay, this is also a community health center. So we used to go here for our posting. Okay, anyhow. Okay, I hope everyone is clear with their doubts. Okay, so thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.